It is my pleasure to kick off the afternoon session with the presentation of the Visionary Leadership Award. So glad that Bonnie could join us. She just came over from something she was doing with the dean. All right, so I'm going to try to tell you about Bonnie Maldonado in 10 minutes or less, which is quite a challenge. She is a professor of pediatrics and health research and policy and senior associate dean for faculty and development at Stanford School of Medicine. Bonnie is an inspirational leader whose career is characterized by pioneering clinical and epidemiologic research in pediatric infectious diseases, combined with tireless advocacy to reduce health disparities and to promote faculty diversity. Bonnie embodies the mission of the MCHRI in every way and is a role model for future leaders in pediatrics. Her academic interests are in the epidemiology and prevention of pediatric infectious diseases, with a career focus in prevention and treatment of perinatal HIV infection, vaccine preventable diseases, and international health. As she said to me in the earliest weeks of the pandemic, I've been training for this all my life. After her pediatric infectious diseases fellowship, she completed training as an epidemiologic intelligence surveillance officer for the CDC. She has led several NIH, CDC, Gates Foundation, and WHO-funded domestic and international pediatric vaccine studies, as well as studies in prevention and treatment of perinatal HIV infection in the US, India, Mexico, and Africa. So I'll just tell you two examples. In the early 90s, she initiated an NIH-funded investigation of the host and viral factors affecting the immunogenicity of oral poliovirus vaccine among Mayan infants living in southern Mexico. She continues to work in Mexico with well-established Mexican pediatric infectious disease and epidemiology colleagues, conducting NIH, WHO, and Gates-funded studies of the immunogenicity of aerosolized measles vaccine in Mexican infants, and studies of polio vaccine immunogenicity among Mexican infants, contributing to the goal of global polio eradication. Turning to her work in HIV, she's also been the site PI for perinatal HIV prevention studies in Zimbabwe, initially through the NIH-funded HIV Prevention and Treatment Network and the NIH-funded International Maternal, Pediatric, and Adolescent AIDS Clinical Trials Network, also known as IMPACT. She was a Zimbabwe PI of a phase 3 study of the safety and efficacy of extended nevirapine administration to breastfeeding infants for the prevention of perinatal HIV infection. She was co-director of the Zimbabwe AIDS Prevention Project, a collaborative University of Zimbabwe Stanford University academic center through which she conducted NIH-funded studies of shedding and transmission of oral polio vaccine mutants among HIV infants. She is currently the PI of the NIH grant entitled A Genomic Tool for Identifying Pathogenic Circulating Vaccine-Derived Polioviruses. Moving beyond her research program, she is currently chair of the American Academy of Pediatrics Committee on Infectious Diseases, a member of the board of the Pediatric Infectious Disease Society, the editor of the report of the American Academy of Pediatrics Committee on Infectious Diseases, also known as the Red Book, and the AAP liaison to the USPHS CDC Advisory Committee on Infectious Diseases. She has served on numerous, really too many to list, other national and international committees in pediatrics vaccine development, infectious diseases, including as a former member of the board of scientific counselors for the Office of Infectious Diseases, CDC, and the US HHS National Vaccine Advisory Committee. Since the onset of COVID-19 pandemic, she has been the face of our response at Stanford University. And Paul King once said that, like Beyonce, she's known by her first name across this campus. Yes, Bonnie, I'm going to repeat that every chance I get. She has added new responsibilities, since the pandemic, she's added new responsibilities, including a member of the California Precision Medicine Advisory Committee, member of the California COVID-19 Academic Advisory Committee, member of the California Western States COVID-19 Scientific Safety Review Work Group, and a member of the NIAID Data Safety Monitoring Board for Active 3 clinical trials. Bonnie is a very distinguished educator. She has directed 2 NIH T32 training grants here in infectious diseases and EPI, and has devoted substantial effort to teaching and training activities, as well as here at Stanford, as well as nationally and internationally. As the chief of the Division of Pediatric Infectious Diseases, she has fostered the careers of countless physician scientists. She's trained over 30 undergraduates, including honors theses, over 20 medical students, 10 master's students, and 5 doctoral candidates. At the national level, she's worked with the AAP and the Pediatric Infectious Disease Society in the development of teaching and training programs for medical students, residents, and clinicians. And at the international level has been involved with direct teaching and mentoring of students, fellows, and junior faculty in Mexico and in Zimbabwe, where she is a co-investigator of a University of Zimbabwe NIH-funded grant to support and expand infrastructure for the University of Zimbabwe College of Medicine. Last, throughout her career, Bonnie has been resolute in her lifelong commitment to improving cultural and gender diversity at all levels of this institution and in academics in general. This includes her involvement on several ad hoc and standing committees and working groups at the university, the School of Medicine, the AAMC, and the NIH. For example, she served on the NIAID focus group on improving academic research opportunities for minority biomedical physicians and scientists, and the AAP Task Force on Diversity. She is currently a member of the American Pediatric Society Committee on Diversity and Inclusion. As you all know, she is the Stanford School of Medicine Senior Associate Dean for Faculty Development and Diversity, and under her leadership, the Office of Faculty Development and Diversity has offered a variety of professional development programs, networking opportunities, speakers series on cultural considerations, grants on health disparities, and skill building workshops. She also was awarded with her colleagues an NIH U54 to establish the Stanford Precision Health for Ethnic and Racial Equity Transdisciplinary Collaborative Center. It's one of 5 national centers funded by the National Institute on Minority Health and Health Disparities to focus on using precision medicine tools to improve the health of underserved ethnic and racial groups. Bonnie now leads the center and is focused on fundamental questions about health and disease among minority populations that are traditionally underrepresented in clinical research. Bonnie has many, many awards. I'll just mention a few. These include the CDC Alexander Langmuir Epidemiologic Intelligence Service Alumni Award, the Stanford University Multicultural Alumni Hall of Fame Award, the Lucile Packard Children's Hospital Distinguished Service Award. She has served as medical director of the infection control for over 15 years, the Stanford Medical Alumni RISE, that stands for Reach, Inspire, Serve, and Engage Award, the National Hispanic Health Foundation Leadership Award, and the 2020 Stanley Plotkin Vaccinology Lectureship Award from the Pediatric Infectious Disease Society. More recently, she's been further recognized for her myriad contributions related to COVID, including the Santa Clara County Supervisor Award in recognition of her community work, and of course, the President's Award, Stanford President Award for Excellence through Diversity at Stanford University. I am so delighted that Bonnie will add the MCHRI Visionary Leader Award to her long list of accolades. She's an exceptionally gifted and accomplished educator, advocate, and scientist whose research has saved the lives of countless children and inspired pediatricians worldwide. Please join me in congratulating Bonnie on the receipt of this award and thanking her for extraordinary contributions to our community and beyond. Bonnie, I look forward to giving you this lovely award in person. I'll have to find you soon. So congratulations.
Thank you, Mary. I don't want to take any more time. It's really lovely for you to have been nominated and to have this amazing award. I'm just honored to be able to have had the opportunity to get to this point in my life. I don't want to talk about my story, but my own background was not a background that would have led me to anything that I'm doing now, but it was because of other people who went before me and helped pave the way for me to get here and mentor me, that I was able to help others. And that is my role today, is to provide opportunities for others to reach their full potential and make this a better world. And boy, do we need it, given what we have seen in the last 18 months in particular. So thank you so much. I think pediatricians and people who work with children and families are the future of our society and even our civilization. So I love the work that you're all doing. And thank you so much for including me in this amazing group of researchers and clinicians and educators. And for you, Mary, for your leadership, of course.
Oh, my pleasure. All right. Well, that's a good segue, Bonnie, into our next session. I know you're really passionate about training the next generation. So the next session is entitled Groundbreaking Research from Rising Scientists. These are MCHRI early career investigators and trainees. And with that, I'm going to pass it on to Liz and Sriram.